Well, good afternoon. More than 4.6 million vaccine doses have been administered in our city by Team Toronto, with 77.6% of eligible residents in our city now fully vaccinated. We're continuing to make progress. Getting people vaccinated right now is our objective. It is something that we are laser focused on. There are 22 clinics happening right across the city, including walk-in appointments from 1 p.m. to 7 p.m. at our 5 city-run clinics, and the accessibility to most of the other clinics is also very high in terms of people's ability to get a vaccination. Dr. de Villa will today be outlining important data about the COVID-19 vaccines. But the data shows that COVID-19 vaccines are your best protection from the virus. COVID-19 vaccines are the best protection from the virus. The data shows that the COVID-19 vaccines will help you stay out of the hospital. The data shows that more people are doing the right thing and getting vaccinated following the province's proof of vaccination announcement, for which I commend the Premier and the government. Simply put, it was the right thing to do overall. The data shows that the vast majority of Toronto residents who have received their vaccine doses have had a good experience getting vaccinated. Toronto Public Health has also worked to help put our 90% vaccination target in perspective. And I think it's important for the public to have these numbers you're going to hear about today so that you can see that the 90% target is attainable. This is something we will get done as a city. We've done so well so far, and done so well in a way that is globally competitive with other global cities like us. It has never been a matter of choice for us as a city to strive to reach that number based on expert advice as to what we needed to do to protect public health and to protect the schools and to protect the economy. But we have to have the confidence about what we can do as a city as it becomes a bit more challenging for us. While it is still a challenge that lies in front of us as a city, we should look at it this way. We have already vaccinated millions of people. We have thousands to go. Not millions more, thousands more. But do that, we must as a city. We must do this together. We're working non-stop on the Team Toronto mobile strategy to make it as easy as possible for people, bringing vaccines right to people's front doors in some cases. Yesterday, we had vaccination clinics in 2 TTC stations, Islington and Warden. And again, around 50% of the people vaccinated were receiving their first dose. We continue to see the steady success of these clinics when it comes to reaching those who haven't yet been vaccinated. Dr. de Villa and I have seen it. People who, presented with the opportunity as they just walk by, stop in and get vaccinated. We will be announcing more clinic locations right in TTC stations in the coming days. And along with our continuing daily vaccination efforts, dozens and dozens of clinics each day, I've asked Toronto Public Health and city staff to work with our Team Toronto partners to launch a day of action in the next 2 weeks to help further drive up vaccination rates and build on our success. We have to create an even greater awareness of the challenge that does continue to lie before us and the importance of meeting that challenge, as we will. I know Public Health and all of Team Toronto are determined to reach our 90% vaccination target. This is something where we are unanimous in saying we will do this and we can do this, as we must do this. We are laser focused on reaching this goal so that we can protect the great progress that we have made because of the global leading numbers that we've put on the board already in terms of getting people to get vaccinated. And that, in turn, will protect the health of all of the residents, it will protect the schools, it will protect jobs, it will protect all of the progress we have made from the darkest days of the pandemic. And I will say this before moving on to talk a little bit about City Hall as a workplace. It is long past the time when we can, as a city, afford to have people knowingly spreading disinformation about something where the science is clear and where the benefit to the broader public health and to the broader public interest has been settled a long time ago. We're also continuing with the safe reopening of city buildings and of the city workplaces. The vast majority of city employees, of course, have been in their workplaces throughout the pandemic. Around 80% of city staff are frontline employees delivering services to you. You see them on the streets and in your neighbourhoods all the time. and they've been continuing to work on location, delivering critical services in person since the start of the pandemic, and they will continue to do so, and I thank them for their continuity and for their efforts throughout that time. You'll recall at the start of the pandemic, the city ramped up its telework capacity from around 1,000 people to around 10,000 workers so that people who were not on the front lines could work from home and continue to provide vital public services. Last month, the City of Toronto reopened its doors for select in-person counter services at City Hall and at the Civic Centres. It's been wonderful to welcome residents and visitors back into these buildings and to welcome back some of the people who weren't at those posts during the worst days of the pandemic, and to welcome them back for the first time since March of 2020. About 12,011 residents have been served in person at these reopened counters since the 9th of August. An average of 3,000 residents were served in person per week over the past month. The top 3 most visited services as a matter of interest at the Civic Centres were tax and utilities at 3.7 thousand, marriage licenses at 1.7 thousand, and court services, provincial offence payments and inquiries at 1.2 thousand. Starting this week, City of Toronto staff who have been working remotely during the pandemic will begin to return to our office buildings. This phased return will be done most of all in a responsible and coordinated and safe manner that respects the health and safety of our staff and the entire community. This continues to be our top priority. But we will continue to make all decisions based on public health guidelines and workplace safety measures as much as we want to have people back working with us and serving the public in person. The safe and gradual return of office staff who have been working remotely into our city buildings will ramp up over the next several weeks. Employees will work in the office, some will continue to work remotely, and some will be doing both. Building, elevator, and floor capacity limits, in addition to staggered and spaced workstations, will be in place to ensure the health and safety of all of the city's employees, as well as continued use of masks, daily screening checks, and increased sanitation and cleaning protocols. The safe return of our office staff to City Hall and other offices signals another important part of our city's recovery. More people out and about means more people supporting local businesses and restaurants and shops and supporting the local economy, the very local microeconomies that exist in different parts of the city where people traditionally have gone to work but perhaps haven't been at work as much during the course of the pandemic. We know that a lot of those microeconomies have been deeply impacted by the pandemic, and while we're going to do it safely, we will have a gradual, safe return of people to work over time as circumstances dictate. It is my hope that this announcement of our own approach to this, done safely and done carefully, will inspire other businesses to follow this example and do the same in a safe and responsible manner and help Toronto return to a more active and thriving city once again. But safety does come first. These are good, positive steps forward for our city. While we still have a pandemic to fight, and we believe you me, we do, and you'll hear more about that from Dr. de Villa, I believe we are making progress, and most importantly, we have a weapon that works in the fight against COVID-19 and the Delta variant in the form of the vaccines. Our progress so far is, yes, thanks to a good effort that we have made as a city, administering with our health partners the delivery of these vaccines, but the thanks really belongs to the millions of people who have gone and got themselves vaccinated. And I know that that progress will continue as more and more people get vaccinated in the days ahead. It is also thanks to residents who follow the other public health measures, and we mustn't forget those as much as we're very focused on getting people vaccinated. And that includes wearing a mask when out in public. We have to continue to be cautious. We all know that, and I think the vast majority of residents are following along in that spirit. We are closer to the end of this pandemic than to the beginning. I've had occasion to speak in the last few days, as I will do tomorrow, about events that really mark the reopening, the gradual back to normal status of our economy. I am very optimistic about this city and its economic future. People continue to inquire of us to this day about investing and creating jobs in our city. Companies that are here already continue to take the step to recommit themselves by expanding their investments and their workforces here. And slowly but surely, things like transit ridership are returning towards normal levels. They're nowhere near there yet, but the signs are all positive. So we just have to keep on with the other positive signs we're seeing, which relate mainly to vaccination. And I know if we do that and continue to care for one another and support one another, as we've been doing through the pandemic, we can get to where we need to be. So I encourage you to encourage your friends and your co-workers and others you know to get vaccinated. Dispel the misinformation that people are misguidedly putting out there about this, and make sure people know the facts based on the science. Speaking of the facts and speaking of science, I would now like to ask Dr. de Villa if she would present her remarks for today.
Thank you, Mr. Mayor, and good afternoon. Last Friday, Dr. Theresa Tam, Canada's Chief Public Health Officer, said that without more vaccinations and reduced contact between Canadians, cases could rise to 15,000 a day in October. That is a stark statement that echoed what was forecast by the COVID-19 Science Advisory Table 2 days prior. I agree that more vaccinations and reduced contact must happen, and happen now. Fortunately, both are directly under the control of each and every one of us. Where we are today feels frustratingly familiar. Some of what I tell you today will sound familiar as well. I've said it before. I say it because it works, and because we have seen it work. We have a lot more flexibility in our lives, which we need to work to preserve. School is resuming with a significant number of young students unvaccinated at this point. The best way to preserve the flexibility in life that we have, and to protect that large number of little people who can't yet be vaccinated, is to drive up vaccination levels and adjust our contact with each other. Another reason, on an individual level, is that vaccination continues to be the best protection against ending up in hospital because of COVID-19. Toronto Public Health data indicates that case rates amongst unvaccinated individuals are approximately 7 times higher than amongst those fully vaccinated. On top of this, based on currently available information, the vast majority of those who are in ICU, more than 90%, are not fully vaccinated. In order for Toronto to get to 90% full vaccination coverage, that's 2 doses, approximately 336,000 more people need to complete vaccination. Some are halfway there. At present, of those who are in between dose 1 and dose 2, there are about 164,000 Toronto residents who are eligible for their second dose. We've also seen an 18% increase in first dose vaccinations administered to Toronto residents since August 31st. In fact, first doses administered on September 2nd and September 3rd were the highest we've seen in Toronto since July. This may have been a result of people getting vaccinated in anticipation of a return to the office, or the province's announcement on proof of vaccination requirements to engage in different activities. Through mid-August, we surveyed Torontonians to find out what they were thinking about vaccines. In terms of closing the gap between where we are with vaccinations and where we want to get to, and considering the important questions around barriers due to hesitancy, we found some encouraging responses. We're seeing a decrease in vaccine hesitancy in Toronto residents since we surveyed them last March. About 1 in 6 residents, or 14%, can be considered as vaccine hesitant, which includes 6% who said they will definitely not receive a COVID-19 vaccine, and 8% who said that they are unsure if they will in the future. Overall, though, we've seen a 7% decrease in hesitancy since residents were last surveyed in March 2021. The next findings are important when we think about all those children who are heading back to school and who aren't yet able to be vaccinated. The vaccines are safe, proven, and highly effective. In short, they work. About 2/3 of parents with children under the age of 12 indicate that they are ready to have their children receive vaccine when it becomes available. We want that group of parents to join the tens of thousands of parents like them who've had their children vaccinated and taken at least a little weight off their minds as a result. Getting back to the modeling I mentioned at the beginning of my remarks, the fall months ahead of us will not be as relaxed as we might like. The Delta variant has not spoiled everything, though, and won't if we act to give it less room to maneuver. That happens through vaccination and through picking and choosing what we do and when and how and where we do it. The simplest yardstick for reducing contact is this. Ask yourself, is this something you need to do or something you want to do? What simple limits or adjustments can you make to your plans to reduce the number of people you interact with? When you can't physically distance yourself 6 feet from others, do you have your mask handy to easily put it on? Can what you're doing be done outdoors? Or how can you make the space you're in better ventilated, such as by opening windows? I know this is wearying, and I wish I didn't have to say it. But I can no more fail to say it than I could fail to tell you that smoking is dangerous or to get inside when lightning threatens. We have all felt the frustration when asked to limit or change our activity. We have also all felt the satisfaction and the optimism that has flowed from those limits because infections fell and vaccination rates rose. I'm with you. This is tiresome. But as Toronto's doctor, I am behind you. And I can assure you, we can see this through to an end. The best outcomes will happen soonest if we all make sure we're vaccinated and we're really, really deliberate about how often, with whom, where, and how we interact with each other. I'll now turn it over to Lavin for questions.
Thank you, Dr. de Villa and Mayor Tory. We will now open the floor to questions. As a reminder, it's one question, one follow-up, and when we do call your name, we will unmute you. So first up, we have Mark Douglas from 680 News. Go ahead, Mark.
Thanks, Lavin. Question for Dr. de Villa first. Has the fourth wave in the presence of the, and I think I'm summing you up here, but you tell me, has the fourth wave in the presence of the Delta variant delayed Toronto exiting from all the safety protocols, like the masking, like the physical distancing, or were we not really ever close to that time anyway?
You know, Mark, I think that's a reasonable way to summarize things. I don't know that I would talk about a delay. I would talk, as I have throughout the entire pandemic, about adjusting actions in accordance with what we see, both in terms of the data and what we're actually seeing on the ground in terms of real life. We continue to see cases, we continue to see some degree of hospitalization, and on the plus side, we're continuing to see vaccination rates go up and up. So as you heard the mayor say, I think we are closer to the end than we are to the beginning. It is just that we need the continued efforts of all of us together as a community. We do have everything we need to control this within our power. More vaccinations, continuing vigilance around public health measures, and I'm sure we'll get to the end of the pandemic sooner rather than later.
Thank you. And a question for Mayor Tory. You mentioned earlier that you feel it's past time for disinformation. Can you and City Hall do anything, or are you willing to do anything in sort of a civil ethics kind of way to prevent or block or limit anti-vaccination rallies and marches or demonstrations, the kind that we've seen in Toronto so many times before? Is there anything that you guys can do to sort of cut that down, to prevent that disinformation that you don't want anymore?
I think our options in this regard are limited because the enforcement of the law and that drawing of the line between peaceful protest and outrageous misconduct really rests with the police and with bylaw enforcement officers, and in neither case do we direct those people as to what they should do or how they should do that very difficult job. So what I have done is made my own views known to the police chief, just in the context of saying, I hope you'll keep a close eye on that in the context of making sure that we don't allow these people to get carried away with and, frankly, exercise a kind of form of tyranny over people who are just trying to go about their business in a perfectly legal manner and people who are just trying to enjoy themselves having dinner or doing other things in a perfectly legal and proper manner. And I just think that it's also time we started to call out people who spread, deliberate and in some cases outrageous misinformation about vaccines and about, stories they draw off the internet or somewhere that have no basis in fact whatsoever, and just really engage in that business of confident reassurance, comforting information for people based on the expert evidence we have available to us, not just from our own medical officer of health, who's excellent, but from all around the world. And have those people come to better understand, as I think we can do in a persuasive, manner of partnership, that this is best for them, it is best for their families, and it is best for the city as a whole. And I think, as Dr. de Villa has indicated from some of the survey information she talked about today, most people, I think, if we take the time to do that, are probably willing to accept that, as opposed to the very small hardcore that have, different views.
Thank you, Mark. Next up, we have David Ryder from the Toronto Star. Go ahead. David?
Dr. de Villa, if you want.
Oh, you'll just need to start from the beginning. Sorry.
Okay, pardon me. First question for Mayor Tory, and I guess if Dr. de Villa wants to say anything, I'm just hoping you can comment on the TTC union continuing to oppose and telling their members that they, shouldn't go along with or shouldn't just accept the vaccine mandates that are being imposed on them.
Well, they're doing what they, I suppose, think is right for their membership. I don't happen to agree with that. I can well recall the time and effort that we spent, and I'm quite happily so, being at the front lines of making sure that our TTC workers got access to these very same vaccines at as early a date as possible back at the time when that was all beginning, because we knew that we wanted them to be safe and to be healthy, and we were aware of the particular interaction they have with the public on a very regular basis, as much so as many other public servants, to keep the public safe as well. And so I just hope that individual TTC members, there's often a difference between what members of a union will think versus what their leaders say, and I just hope that individual TTC members are very dedicated, devoted operators who've worked so hard for us throughout the pandemic, will make their own judgment about what is in their own best interests in terms of health, what is in the best interests of the public they serve, and what is in the best interest of the city to make it healthy and make sure we can stay open and have the city come back to a more normal state of affairs.
Thank you. And I'll ask, I guess the next question I think is probably for Dr. de Villa, and that's, I know when the province talked about reaching the 90% milestone, they gave some numbers as far as how long it would take at the current rate that we're increasing. I'm wondering if you can offer the same, if we need to ramp it up, if we continued at the pace we're at now, would we get to the 90% in time to avoid, the worst possibilities of a fourth wave?
Well, David, I wish I had a better crystal ball than the one I actually do have, but I will say this. As I mentioned today in the remarks, to get to 90% fully vaccinated here in Toronto, we need another 336,000 more people to get vaccinated. And we've actually seen those numbers consistently come down with the vaccination efforts out there. I think that we need to remind ourselves that this recent vaccination campaign, the COVID-19 vaccination campaign, is the largest vaccine campaign ever undertaken in the history of this city. I continue to be amazed by the number of vaccines that have been given in a relatively short period of time. We are almost there. You heard the mayor say millions of people have gotten vaccinated. We have thousands to go. And, I'm convinced that we will get there sooner rather than later. We just need people to continue to come out, to make sure that they're getting themselves informed and being informed by the science. We have healthcare partners, along with those of us at Toronto Public Health, working very, very hard to make sure that these vaccines are available. And the more we are able to drive vaccination coverage up, the better off we will be in respect of the current fourth wave.
Thanks, David. Next up, we have Matt Bingley from Global. Go ahead, Matt.
Hi to both Dr. de Villa and to Mayor Tory. Earlier today, Dr. Lowe from Peel Region was suggesting that in order to reduce contacts, he was actually suggesting that people work from home longer, and especially if they're able to. Today, Mayor Tory was mentioning the fact that more workers are coming back to city buildings, and he's hoping that that will lead to more businesses doing the same. And I'm just wondering why there is such a difference in approaches there, and why you are not calling for something similar for the work from home crowd.
So why don't I start off, and then I'll turn it over to the mayor. So you heard me mention today in my remarks that, as far as I'm concerned, what's needed at this point is a combination of two different things. One is to make sure that we're driving vaccination rates up as quickly as possible and as high as we can get them. And we have every reason to believe that we can actually hit our targets and that we can provide the protective benefit of vaccines to the vast majority of Torontonians. We've already got a significant proportion of our population covered, and we know that through our continued efforts that we can really reach the kinds of targets that we need to see. So we need to push vaccination. I also talked about the need to reduce contact with each other. And to my mind, there really is a lot of control that we can exert at an individual level, and yes, as a community as well, around what are we doing, with whom are we doing it, do we need to do it, or is it something that we want to do? So I think you're hearing quite a consistent message, and I'm sure it's the kind of message you'll hear from medical officers of health across the entire province, that it is the combination of vaccination efforts and adjusting our actions and interactions with each other so as to minimize the potential for transmission that will be what sees us through and what puts us in the best stead as we deal with this fourth wave of COVID-19. I'll hand it over to the mayor now.
I don't think people should misunderstand at all the very balanced approach that we're taking to this. I mean, we've focused first and foremost, and will continue to do so, on getting as many people vaccinated as possible so everybody, including city employees, can be safe. In that respect, secondly, we brought into play a vaccination-proof policy that was, at the time, represented a major step, a courageous step for the city to take, and I think set an example as to what we thought should be done in order to protect the health of workers, our workers, and the public for that matter. And then the third thing we've done, and what I said today, was we are adopting a safe and balanced approach to the return to work of city employees. It will be done on a gradual basis, as I said. It will be done to a workplace that has been modified to make sure it is safe and appropriate through disinfection and reorganization of the workplace itself. And we are also indicating, as I did today, that contemplates many, many workers still working sometimes from home, all the time from home in some cases, or being here on a more full-time basis. So I think there probably couldn't be a more balanced approach to this, and I don't think it's really any different than what Dr. Lowe is saying. We have our approach that we've adopted in the city that I think can work for us safely. And I said again today very clearly, safety will be first, and that means if we have to make adjustments as we go or adjust the throttle in terms of how many people come back, when and in what circumstances, that's exactly what we'll do to make sure that safety is first for our employees and for the public.
And to follow up, Mayor Tory, could you just elaborate a little bit more about what you mean by a day of action for the vaccination campaign? What day would this happen? I know you don't have a precise one, but what are we talking about here? Is this multiple locations? What?
It really is more about multiple locations because we have reached the stage and we have learned that the notion of these kind of mass vaccination clinics, or even trying something today like the Scotiabank Arena, which worked magnificently at the time it was done, when we were probably, I forget, in the 50s in terms of percentages of people vaccinated. But when you're dealing with people that need a bit more encouragement, a bit more information, a bit more persuasion, a bit more of that person-to-person contact, you are more likely to see us put on the day in question, a whole series of events. So we'll have events in multiple locations. Maybe we'll have them in quite a few subway stations on one day. Maybe we'll have it in malls or schools, or have those buses all out, doing the kinds of things that they're doing, but on a very targeted community by community, building by building, street by street basis. But it'll be a day on which we try and concentrate that action to really raise awareness, but also to get as much done in a day as we can. So it's that kind of concept, which is just a different way of getting this done and drawing attention, given that we're down to the millions done, but thousands to go, but the thousands are in very precise locations in need of perhaps a little extra work on our part to get it done.
Thanks, Matt. Next up, we have Scott Lightfoot from CTV. Go ahead.
Thanks, Lavin. Question for the mayor. I was talking with dozens of people who live along the Esplanade today, and they really feel the city is not listening to their concerns about the impacts that the temporary homeless shelter in the Novotel is having on their street. They say they no longer feel safe on the street. They've been harassed, threatened, assaulted. They say they have to walk through garbage, human waste, drug paraphernalia. And they say they've reached out to the organization that's running it, to the local councillor, and to your office on multiple times. And according to them, absolutely nothing has been done. So I'm just wondering what you can say to these people, some of whom are literally afraid to leave their homes now. And what can the city do for residents who've had these emergency shelters sort of dropped in their neighborhood with little to no consultation?
Well, people in public service, including myself, have two very distinct obligations that we have to fulfill at one and the same time, and sometimes it can be challenging. Those two obligations being, of course, to make sure that we care for the most vulnerable people in our city during an emergency pandemic circumstance, and at the same time to maintain the stability of neighborhoods for people who live and work in those very same areas. And what we have done is we have cared for the most vulnerable people right across the city, and I thank the people who live in those neighborhoods for the fact that they have accepted and welcomed the fact that we needed to take care of those people in a different way because of the effects of the pandemic and some of the health requirements. I have been very engaged personally in dealing with some of the particular neighborhood challenges that we have faced. I will take it upon myself to review all of the input that has come to my office, but also, more importantly, to have a conversation with some of the representatives of that community to understand those concerns better, because I find when I do that, it puts me in a better position to reach out to whether it's the housing people, the agencies who do a great job for us helping to run these facilities, the police where they need to be involved, the bylaw people, and assorted others. So I will undertake to do that for that particular shelter, but I can't in any way abandon my responsibility as mayor to make sure that the people who are most vulnerable, most in need of care, extra care at this time, especially in our city, are cared for. But we have to try to do it in a way that is obviously maintaining at the same time the stability of neighborhoods. So I will take a look at that and see what I can do to be helpful.
And just to follow up on that, so the city's lease on this hotel is December 31st. I'm not sure the end date on the other temporary shelters, but the neighbors are hearing that this lease may now be extended into next year. It does seem unlikely that the city would toss these people out in the middle of winter. Can you confirm whether or not the city is looking at extending these temporary shelters? And what exactly is the city's short-term plan? I mean, I know housing is a long-term plan, but what's the short-term plan for the people in these shelters, be it December of this year or April of next year, when the city has to shut them down?
Well, obviously, you put your finger on the real challenge, close a given shelter. And let's remember, a lot of these shelters in hotels were created because of the requirement that we have physical distancing as distinct from how people were accommodated in the shelters previous to the pandemic. And so what we're doing is we are focusing our efforts hugely on getting as much supportive housing actually built. One of the reasons we have been so embracing of the rapid housing initiative brought forward by the federal government is it actually has allowed us to already have hundreds of supportive housing units, which are units that can be represent housing for some of the very same people in place. There are people living in some of these developments now that we started to build 6 or 8 months ago. And so we're moving ahead with that and as much housing as we possibly can. We have a very ambitious target for this year, which I am confident we will meet. We are reviewing all of these leases on a case-by-case basis because winter is coming and we have to make sure that as the weather deteriorates that we have adequate accommodation available for the people who need to have shelter from us. So I can just say to you that there is no hard and fast rule about leases being extended or not. We're dealing with this on an overall planned basis for the entire city, right across the city geographically. But again, we are very focused on fulfilling the 2 responsibilities we have: to look after the people who are most vulnerable, who are experiencing homelessness. They're not breaking laws and they're not committing any, bad deeds. They are people who happen to be homeless. And they're experiencing homelessness, and we have to look after them, but at the same time we have to make sure that to the best extent we can, we do that in a way that provides them with supports and make sure that the neighborhoods in which they are provided with shelter by us are able to maintain a stable existence, and we'll continue to do that.
Thank you, Scott. And last, we have Samantha Beatty from CBC. Go ahead, Samantha.
This question's for the mayor. It's about active TO. I was wondering what you want to see happen with active TO after this fall for next year, including road closures on weekends and the temporary on-street bike lanes. Do you want to see this continue next year, or what's the plan?
I want to see as much of this kind of making available of public infrastructure to people to keep them healthy and to allow them to be safe in engaging in outdoor activities as possible. And it is my wish to see these programs made permanent. But I think that should only be done after we thoughtfully examine the data from what we've experienced this summer and last summer with both the active TO road closures to accommodate this outdoor activity and with the bike lanes, and just to see what the experience has been. And that is exactly what I've committed to do, which is to have a full review of that when I'll call it the season is over, or this current season. Look at the data, of which we have lots on ridership and on attendance and on traffic patterns and all kinds of different things, impact on the economy and the businesses that surround these areas. But I would like to see the active TO program and the Cafe TO program made permanent, but it's the parameters of it and how and when it occurs that you have to sort of decide based on not my opinion or anybody else's opinion for that matter, but based on, yes, opinions, but also based on information we have about the facts.
And what about expanding it to other neighborhoods? I've been talking to some pedestrian cycling groups that say that this shouldn't just be something that's available to people that live downtown, and they would like to see it in Etobicoke or Scarborough, where people also are interested in getting out there on the weekends. Is that under consideration?
Well, as you know, there were a couple of instances this summer, at least 2 I can think of, one at the Allen Expressway and one at Black Creek Drive, where we actually did close a road, albeit only for a day or 2, in some of those neighborhoods that were not downtown. And we did it in part to provide people with the opportunity to take advantage of active TO in those neighborhoods. And so again, we will take the facts derived from those initiatives and see what the response was, see what the impact of it was, and we'll make a decision accordingly. But it was at my initiative that we in fact invited people across the city. We invited every single ward to suggest that they would like to take part in this program and that we were willing to look at closing roads and other things to accommodate some experimentation in that regard. And we had a limited response to that. And so I'm very willing to take a look at it and very willing to look at the data. And again, I would like to see it, if possible, whether it happens every week or in every place, be something that could be enjoyed on an even wider basis across the city. But that remains to be seen in terms of the review we'll do once this part of the season is over.
That's it for today, everybody. Thank you and have a great rest of your week.